starting with a bit of refining the deeper work with the forearm techniques. So first of all, your position. Yeah. So when your position, your direction of the 4 point, remember the 4 points, should be relatively to the direction that you are moving. So if you want to move upward, you are less likely to have your position that way. Because where are you going to take the force to move this way? So you do need to position yourself appropriately. Yeah? You need to position yourself now. You can't position yourself too upward because the client is here. So you need to compromise a little bit, but try as much as you can to go to the direction of moving. So this is first. Secondly, you would see that a lot of the weight to start with is on the hip is on the front leg. So I can start this way, but it doesn't give me all of the weight is actually here. Yeah, I need the weight to be there, so I need actually to move and to put the weight more on the front leg. So just to exaggerate, it's going to be something like that. Yeah, but so don't do that. Yeah, but bring the weight more to the front leg, and then into the table. Now, a suggestion from Simon is that what you can do to practice is just put, don't use the other hand, put it here, and actually both hands just to lean equally. That would teach you just the leaning. Then after that, you can take one hand up and put it if you need. But just to start with, just lean. So one hand on the glute, one hand on the back, and you just equally lean. Even just flex your head and relax it. Good. Don't attempt to move right away. Take the time to sink. It's like a submarine, really. You find, and it's a negotiation. You find position, you change your weight, and then you look and to get feedback from your client. So you're starting now. Can I go deeper?
Yeah.
Is it good enough now?
You can go deeper.
Yeah. Okay, and then I move backward and wait. And then now it starts moving. So don't rush into right away try. Yeah? Few other issues is where your body position. This is too forward. Yeah, the roller. You need the handle to be behind the roller a little bit. But again, not with the hip backward, the hip forward. So you need to play. You need to find the golden ratio between where your position is, where your hand is. You might need to move a little bit, but don't move this way. Move forward. So you might need to move that here. So it's a lot of fine tuning and then sinking. Don't rush it. Yeah? And all the time feel how it is. Don't rush into doing it because you don't want to injure yourself. Okay? You need to learn slowly and then do it. Do you want another go?
Yes.
Why don't we do that, and I'll add one more thing. I'll add what happened once you're around the shoulder. Okay? So, first of all, how long in time do you think it would take a good deep tissue from here to here?
A minute, two.
A minute or two, yeah? So you really need to take the time. So let's start. Coming to here, you're finding your position and you're sinking. And then you start the movement. once I feel that the roller go forward, I do something very little with my feet. That. So I don't stomp, I don't move, but really just propel myself a little bit forward. Once I get into the scapula, if I'll continue, I push her shoulder up. So I need to avoid that. And what I do is just move my elbow that way. Yeah? However, when I kind of down to about there, I usually stop. Why? If I start more, I will drag the neck and increase the lordosis. So if I'll come down even further, which you can, but what I do now is go to the side. But I don't continue on the spine.
Yeah.
Does it make sense? Yeah? So good. So I come to here and then I can actually drag myself and even push a little bit traction on the shoulder. So again, from here, when I start observing or feeling the scapula, I turn. And again, the turn, what actually turns? Do I turn my elbow?
Your body.
I turn my body. And then I continue. And then slowly down this way. Okay? If I want to do it the opposite way, you can, but it requires, because you need to start really low, it requires a different technique that we'll do after, okay? So let's work more onto the lower back, and then try to do the change, and then one or few longer swift on the whole of the rectus spine. Yeah? Cool.